So we are discussing about the digastric muscle. As you can see here, this whole is the digastric muscle. It is a muscle from the suprahyoid muscles. Okay. So from this view you can see there are two bellies of the digastric muscle. So if you see, this is the anterior belly, this whole, and this one is the posterior belly. So there are two bellies, anterior and posterior, and they are connected together by a fibrous loop. So one by one we will be going to see the origin and insertion of both of these. Talking about the origin of the anterior belly first. So this is the anterior belly. Okay. So it is originating from the digastric fossa of the mandible. You can clearly see here. Okay, the digastric fossa of the mandible. It is originating. Talking about the posterior belly, you can see here, this is the temporal bone. So on the temporal bone, here you can see this from the mastoid notch on the temporal bone, the origin of the posterior belly of digastric is there. From the mastoid notch of temporal bone. You can see here clearly, okay, from this view. Then both of these are inserted. They are inserted in the fibrous loop. You can see here fibrous loop. Together they are meeting, and they are meeting at the fibrous loop, and this fibrous loop or pulley is attached to the hyoid bone here. So you can see this. Attachment is on the hyoid bone. There is one more peculiarity. So you can see this one is the stylohyoid muscle. See, this is also a suprahyoid muscle. The one peculiarity is that the posterior belly or the digastric muscle, upon inserting, is perforating the stylohyoid muscle. So here you can see that stylohyoid muscle is perforated by the digastric muscle. So this one is a peculiar feature. So I hope you got the origin, insertion. Talking about the nerve supply. So if we talk about the nerve supply, the anterior belly is supplied by the nerve to mylohyoid. Okay, so this is by nerve to mylohyoid. Okay, and the posterior belly is supplied by facial nerve. So this is what the nerve supply, origin, insertion is. Talking about the action, it depresses mandible when mouth is opened widely. Okay, so when mouth is opened, it depresses mandible as the attachment is all of the anterior belly. So there is action is this one.